Good afternoon, my name is Amy Muniz, and this is our Tay-Sachs disease presentation. Our group is Group C, and it consists of myself, Amy, Desiree, Irvin, Heather, Tariq, and Catherine. Our first slide is a description of Tay-Sachs disease. It is basically a disorder that destroys nerve cells in the brain and spinal cord. The child may look normal during these 3 to 6 months. They have good health, but from there on after, they will start experiencing slow development. The child's muscles will start to weaken and they'll start to lose their motor skills. Not only that, but the child will start experiencing seizures, hearing, and vision loss, including paralysis. And then children who suffer from Tay-Sachs disease typically live into the early childhood. The second slide is cause. Tay-Sachs disease is caused by a defective gene on chromosome 15. This defective gene makes it so the body is left unable to produce a protein called hexosaminidase. Unfortunately, if the body is unable to produce this protein, then a chemical called ganglios, which builds up in the nerve cells of the brain and destroys the brain cells. The disease is a genetic disorder that is passed on from both parents. Although this disease can be carried by anyone, it is much more common among the people of Ashkenazi, the Eastern European Jewish descent. 1 in every 30 people of Ashkenazi Jewish descent is a carrier. The next slide is treatment. Though there is no specific treatment for Tay-Sachs disease, there is standard therapy and investigational therapies. Standard therapy is for the basic symptoms and kind of pain that the child is dealing with. So we first have nutritional support, which is the feeding tube that helps the child get its nutrition. And then we have anticonvulsants, which helps with seizures, monitoring them and reducing them. And then we have the basic pediatricians, neurologists, audiologists, eye specialists, and counseling for the child and for the parents. We then have investigational therapy, which are still experiments that are being observed and worked on. The first one is gene therapy, which is when the defective gene is replaced with a normal gene. This experiment is still having some technical difficulties, so they're still working on it. And then we have chaperone therapy. It's small molecules attached to a new hexosaminidase, and in this, they're just trying to make the hexosaminidase perform normally. And then we have enzyme replacement therapy, which is replacing the missing enzyme in those who lack it. And then we have a medicine, which is pyrimethamine, which has shown an increased activity of the hexosaminidase, but it has not shown a significant change in development. We then have our prognosis. Unfortunately, even with the best of care, the average lifespan for a child with Tay-Sachs disease is about 4 to 5 years old, usually from a recurring infection. Though there is no form of treatment that can slow or stop the progression of the disease, the main priorities for doctors is to just keep the child comfortable until their death. And then by doing so, you can prevent complications, managing their symptoms, and managing their infection. By doing so, one can increase their quality of life as much as possible. We then have some strategies for parents and teachers. There is no known cure for the disease, so it is important that the child gets support from both the family, the teachers, and just everyone around them, their whole environment. It can be hard for parents to cope, but we did find some support groups such as the National Tay-Sachs Allied Diseases Foundation and March of Dimes Foundation. We also found that working with genetic counselors to provide support and coping strategies is really essential in just helping the child get that support, and their parents get that support as well. And then parents should provide the child's teachers with information on Tay-Sachs and work with the school teachers, the nurses, the principals to just make sure that the child is getting the proper care, that the child has that support system, and just help them function as well as they can. And in doing so, you can provide special treatment guides for the teachers and nurses, just kind of personalizing how the child should be treated and how they should be helped. And lastly, we have our references. This is the conclusion of our presentation. Let us know if you have any questions. Thank you.